Hello, I'm Sophie Rovner from the American Chemical Society. Welcome to this news briefing from ACS Spring 2021. We're joined today by Dr. Shalini Prasad from the University of Texas at Dallas. She's developing a sweat sensor that could alert doctors and patients to a looming COVID cytokine storm. Dr. Prasad.
Thank you, Sophie, for that nice introduction. And hello, everyone. What you're going to see in just a little bit is the Sweat Sensor DX platform. This is the first and only sweat wearable that can help measure, report, quantify, and track in real time and in an on-demand manner cytokines and chemokines. I'll help you unpack all of that after you see this little video. So what you saw just there was the sweat sensor in action. It comprises of two parts, that little orange yellow little strip that you see on your screen, that is that sweat sensor, and it's connected to that reader, the white thing that you see out there. And together, it is a transformative technology that allows you to measure and report cytokines from sweat as well as chemokines. So what are these? These are nothing but messenger molecules that your body puts out when your immune system is triggered by a pathogen or a bug. So once that trigger occurs, your body is releasing all these messenger molecules into your bloodstream. And the vision here is that when we started this work is that these molecules would then percolate from your bloodstream and you'd eventually see them present in sweat. And then you could measure this from sweat in a real-time continuous manner. So before we even got into all of this technology is truly transformative because we started doing this work in 2018. In fact, with our collaboration with BARDA, the Biomedical Advanced Research and Development Authority, their Drive Enact program, they funded the first project to Enlicense, who is our collaborator on this work. And the idea, the vision we had was that, could we build a passively tracking wearable that we could put on humans such that grandma could then figure out if she was in an assisted living facility, hey, that there's an upregulation like a check engine light or an early notification that would tell her she's sick, or little Johnny, when he's getting to school prior to that, would figure this out. And this is all in the context of the seasonal influenza epidemics that we were going to see in real time. So this is what we were thinking behind our vision in terms of when we approached this. Over time, what has happened, especially in the last 12 months with the onset of the pandemic, now all of us know about the impact of cytokines and the importance of the cytokine release syndrome or the cytokine storm that ended up happening. And this is where this technology truly gained traction, and we got into the situation where we could think about applying it for any indication or any disease that could lead to the enhancement and the regulation and the production of these cytokines and chemokines, the messenger molecules. So truly, this is a check engine light that could help the users figure out in real time through early notification what to do. Actionable data to the patient or to the user to help them make decisions that would then help them keep themselves safe, the community safe, and everybody around us safe. And this is far more important today in the world we live in. Over to you, Sophie.
All right, thank you very much. Stop sharing. So at this point, I'd like to ask if there are any questions from viewers, and if so, please state your name and affiliation in the chat window when you type in your question. While we wait for questions from viewers, I will begin with a few of my own. So first of all, can you tell us what cytokines do in sick people?
So cytokines are the molecules that primarily then essentially engage or activate our immune system. So once the trigger occurs so if it's an infectious disease trigger, such as a pathogen, then the immune cells are co-opted, cytokine messenger molecules come forward, and they further activate other immune cells. And then our body starts to have what is called as a pro-inflammatory phase, where these pro-inflammatory cytokines, molecules that are representative of enhanced inflammation in our body, start to go up. And if they go up gradually, then generally your body's anti-inflammatory response, when it's starting to address the cause of this inflammation, kicks in. And so then you settle back and hopefully come back to your wellness or healthy state. But sometimes that doesn't happen. And we've heard that quite a bit in the recent pandemic, where once these pro-inflammatory cytokines start upregulating and elevating, it's like a runaway train that's just frankly just amplifying itself. And then the interventions have to be done in such a real-time manner and in with very small windows whereby you could treat patients, and the intervention has to be like adjusted very quickly. So in a sense, these are the surrogates that tell us, these molecules are surrogates that tell us how the body or the host is performing and the host's immune response state.
Are cytokine levels routinely monitored for hospitalized patients?
It is true in standard of care, in clinical, when you're admitted into the hospital, very much so for diseases such as sepsis. So these are looked into, but you have to be in a clinical care setting for you to be able to look at it, because in a blood draw, it is a panel which will be run and will be evaluated. But more so, the relationships are worked out mostly in teaching hospitals or in research, where you're trying to decouple or elucidate the relationship and the time response that comes with this.
Could a person with flu or COVID-19 start to show elevated cytokines before they even experience symptoms of the disease?
That's a very good question. And that's exactly where the idea behind the check engine light or the early elevation comes into being. So as soon as your body's triggered by the pathogen, the messenger molecules start appearing. So the idea here is it's like this. When we look at our blood pressure, we probably might measure it every day. And we all know 120/80 is the perfect number. We need to be in and around that. But when we start, say, measuring it every day and you see it slowly rising up, and say you start experiencing maybe hypertension, then you know it's time to go in, right, to the doctor and and you have to have maybe a panel of tests, run diagnostics to figure out what's happening. This is very similar, except the time scales are compressed far less. So you're monitoring your basal levels and basally your inflamed state of your body. And it will be different for different people, because you might have some chronic diseases which would increase your basal inflammation. For example, inflammatory bowel syndrome would cause patients who suffer from that disease to have to have elevated cytokine expression levels. But irrespective, so then when it's all about tracking the trend lines, right? So it's in any variable we wear, it's telling you you're walking faster today than yesterday. How is it doing that? It's by computing and looking at how you behaved previously. That's the same idea here. The idea of figuring out how your cytokines personalized to you, how is it working? And yes, absolutely, asymptomatic, previous or pre-symptomatic, prior to expressing your symptoms, this is the early notification technology that would help. And that's why I call it a transformative technology.
How would people know that they need to wear the cytokine sensor if they don't have symptoms yet? For example, would a person start wearing it if they found out they were exposed to someone with COVID-19?
So yes, so do I wear this like how I wear my Fitbit or my Apple Watch? We hope we are able to get to that point, right, where you're wearing it as seamlessly as you're wearing another wearable. That would mean that every day, independent of what is happening to the environment you've been exposed, you're already monitoring yourself, because it's giving you that basal data about yourself. But then we do understand, to get to that, you do have to perhaps, as you rightly said, so in this case, in the case of exposure or post-exposure, immediate post-exposure, monitoring those basal levels and trending them up would give you the sufficient time window that you're looking for to see those up regulations. So that would work as well.
What kind of medications can help treat a cytokine storm, and do they need to be given early to be effective?
So cytokines are representative of inflammation in our body. So an anti-inflammatory or a steroidal therapy is typically what is given. And today, and because it's the best case in point is to think about the COVID-19 pandemic. That's what we saw. The idea about patients who got really sick, right, and who were in the ICU, the idea was to figure out when to give the steroidal therapy, whereby you could reduce the inflammation within the body. Because what happens is the cytokine storm then eventually triggers sepsis, which is the life-threatening disease which causes your organs to shut down and eventually have fatal outcomes. So the idea here is that when you administer the anti-inflammatories is going to play an important role. How you administer it in conjunction with whatever, if it is, in this case, it's a viral, so an antiviral, it might have to be looked into. If it is sepsis by itself, then you might have to look at an antibacterial system. So that's an antibiotic would have to be administered. But yes, it's very important, the timing. It's all about the timing.
If someone wearing the cytokine sensor started exercising and therefore sweating, could that affect the results?
This is a very important question. In fact, we played engineering detectives for the last 3 years towards figuring out, first, I will tell you, we were not even sure we would see cytokines in sweat because nothing in literature suggested we would see them. So then we started figuring out why is it? And there were a number of sweat wearables published, and these were people looking at glucose, lactate, other metabolites. So we started thinking, why is it that they're not seeing cytokines? Then we found out that in order to measure and report cytokines in sweat, this has to be truly expressed passively by the body. That is, as we are, so I'm sitting in a conditioned environment. So we do not sweat quite as much. So passive sweat from our body would be very less. So, but we have to use that sweat to be able to measure for cytokines. The second thing we had to establish was whether these cytokines mapped back to what happens in circulation. This is within blood, because otherwise this is no use. I mean, it's just something you see locally, and this is a problem. And this is why we realized why other wearables with sweat didn't succeed, because they had to use a stimulation mechanism, whether it's electrical, chemical, or some mechanism to get sweat out in sufficient sweat volume to build a sensor. We didn't have to do that. So we were able to show that what you see in systemic expression could map back to what you see in sweat. So that when we were able to establish that, then we saw, yes, then other things can impact. As you rightly said, if a person exercises, they sweat more. Our method of measurement is not based on charge, which is what other sweat variables do, using what is known as an amperometric method. We are looking at the inherent dielectric properties of this molecule. So it's very much agnostic to how much fluid you might have or how less fluid you may have, where along the body you're sweating. So because certain sweat glands are far more active than others, right? So like, for example, your lower extremities might sweat more than your upper extremities normally. So if that's the case, would it work better on your lower extremity versus your upper extremity? We did a lot of this. After all, we are engineering detectives, and we came to the conclusion that if it is passive sweat, we have a good shot of figuring out, irrespective of all these variations that may come into piece, truly the reporting characteristic to what happens within circulation. And that's what we showed in our publication, as well as you'll hear more about that in my talk later today.
Can patients be trained to read their own results on a smartphone, or would the data need to be relayed to a doctor?
So this is, again, a very interesting question, right? So there are two ways of thinking about this. This sensor will automatically give you the actual level of the cytokine as expressed, kind of like your variable glucose measurements through your interstitial fluid. So as a patient, you're able to read that and you're able to make an educated understanding, not a guess, but an understanding of what that data tells you. That's the same way we envision this platform's output too. It will tell you when you look at it what it means. But however, this data is a little more complex from the perspective of a user's understanding, because what do maybe a 10 picogram per milliliter of a set of 3 pro-inflammatory cytokines mean to you, right? So we translate all of that back towards a simple check engine light that goes from green, yellow, orange, red. So when you see the color gradation, it gives you the visual clue in terms of what those numbers mean. And yes, it all goes back to your wearable, as we are all now used to looking at it through an app interface and reading what those, and you saw that in the video towards the end, where all the data was going into that wearable app. And you can see all the actual information coming out of your sensor getting transformed into a visual a cue and an output that is easily understood by all of us. We don't have to be scientists to understand what that means.
Does the sensor work in real time, or is there a lag in the data presented in the app?
So again, there are two ways of how I can answer this question. First is, what you see in sweat is going to have a time delay to what is expressed in circulation. So the time delay is in the order of minutes, not hours, not days. It's in the order of minutes. So everything in terms of an algorithmic post-processing correction is done to adjust for that inherent physiological time delay that our body has, which is very true in any of your wearable glucose sensors that you see out there, right? Because the representation from that wearable glucose measurement is again a time delay offset to what you would see from blood glucose when actually measured at the same time point, but the algorithm adjusts for it and it reports for it. So yes, then keeping that in mind, what you're seeing is a real-time output, a real-time continuous output of how your system is behaving due to whatever the environmental cues or the triggering cues that go towards it.
So I'm just realizing, if we're sort of constantly exuding these cytokines on our skin, I would imagine their concentration builds up over time. So how do you account for that?
So this again is a very good question, and the first engineering question that we always get asked, right? So when things build up, are you just reporting a sum total of something, or are you truly reporting to us the dynamics of the difference? Luckily for us, we didn't have to invent that wheel, right? Glucose tells you a lot, right, in terms of what the glucose technology has done. Again, the idea here is pretty much the same. While the assay measurement may be accumulative, the algorithm reporting is differential. So it allows you in real time to parse out the differential measures at each reporting point that you're looking for. So it is able to figure out your upswing as well as the downswing of the cytokines. Otherwise, you're only reporting an accumulative assay, which means you're only going to have an increasing number. So this can tell you the increase as well as the decrease. So very simplistically, if you're teaching a 101 calculus class, a slope of a line gives you the difference in the measure. So that's basically the idea behind this, very simplistically. That way you're able to map the dynamics of your body's response in real time.
All right. Let me see. Are elevated levels of certain inflammatory proteins more predictive of a cytokine storm than others?
This is, again, an area of active investigation, right? So so when we started this effort, we were thinking of a combination of pro-inflammatory cytokines that has been shown to upregulate or elevate for a range of diseases. So acute diseases. So this would be your interleukin-6, your tumor necrosis factor alpha, your interleukin-8. So these family of interleukins are known to go up, indicating of the pro-inflammatory state. Very much so, depending on the disease indication. There are new molecules that are biomarkers associated with that inflammatory paradigm. And again, you need to look at early expression versus late expression. So early expression, I mean, is when, as we talked about earlier, prior to maybe the person having symptoms, right? It starts to go up, but you can see the elevations which have shorter half-lives versus things that have longer half-lives. So the good thing here is this is like a puzzle piece. So, and it's a modular system. You can keep adding as many cytokines to your panel or to your assay. So in short order. So it is in that sense on-demand programmable to the disease indication you're going after. Because you have to keep in mind, you have to read this early notification from this variable in conjunction with everything else that person is undergoing. Because if they have chronic conditions, there are other monitoring. So their profiles are looking different. But this is the opportunity to truly build the personalized variable specific to an individual's response, right? To the host response. And that's where this is.
And are the relative proportions of the different cytokines indicative of the particular illness?
The relative expression profiles, if it's all, it tells you whether it's all in the pro-inflammatory phase, so it's tracking up towards a severe outcome. But it is, so you will see the same groupings or the same, there's a Venn diagram of relationships where similar subsets of cytokines are associated with specific diseases, right? So you will not get a one-to-one mapping between one molecule and one disease. That golden mapping doesn't exist. What we have understood is that you always need a panel. And in a panel, you basically build up the credibility by ensuring that you see behaviors and relationships that track in a particular manner to make that association.
Okay. All right, for your initial observational study, did the people infected with flu have mild, moderate, or severe cases?
So this is where it gets interesting. Our goal was to look for mild folks because that was the intent, right? If you want early notification, they need to think that maybe they have allergies and not the flu. I mean, I remember how many ever times I've had people in my workplace myself think, oh, it's the allergies, it's not the flu. So I'm okay, I'm good, you know, but I really would have liked to know whether it was the allergy and not the flu. So that was the intent. So we really looked at it at a community clinic where a person would even take suppressants, right? Like anti-inflammatory suppressants, like your non-steroidal ibuprofen or Tylenol. People have consumed that, which has actually suppressed some of the inflammatory response. But you still see within that the ability of this technology to nuance and separate out folks that are healthy and their levels vis-a-vis folks that have milder stages of this disease. So we've all looked at it at the end at which it is really mild to, you know, when you go into your standard primary care. That's the way we've looked at in that particular study.
And did the 2 sick people in your observational study who had elevated cytokine levels go on to develop a cytokine storm?
These particular folks were able to get medical intervention because they were because we had partnered on our IRB with the community clinic to do that. So luckily for them and for us, no, they didn't get sick. Severe upregulation. But yeah, but we could see the elevation starting to occur in them.
All right, and when are you planning to start clinical trials on the sweat sensor DX?
So that is the work that we are looking into in the year 2021. So this is this particular year. And as I mentioned earlier, the award from BARDA was made to Enlicense, which is the company which is focusing on the commercialization of this particular platform. So the timelines and everything is contingent on the company. And since I am not authorized to speak, while a co-founder, I'm not authorized to speak on behalf of the company. But all I can definitely tell you is work is currently ongoing to resolve these things, because clearly this is an area of significant public, not only interest, but it will have significant public impact. So that's why we are making the push towards translating it to the next level.
All right, and if you're at liberty to say, which respiratory diseases are you planning to include in the trials?
So I will say broadly, we're looking at upper respiratory diseases and keeping that pretty vast. But yeah, we're looking at all in that nature. And we're also looking at even morbid outcomes, like how those might translate into sepsis and what would happen. So can we catch people in that transition, the bad trajectory, if you will. Mm-hmm.
Do you have a sense of how much the sensors might cost to manufacture?
So the cost of goods is something I'm not at a liberty to speak. What I will tell you, it is low cost of ownership. So all of us who are very familiar with how flexible semiconductors work, we know that as you increase the quantity of the sensors, the cost goes down in an exponential manner. And this has been designed to have a low cost of ownership, because we want this to truly be a global technology. So whereby we are also very conscious about costs associated with cost reimbursement in the context of insurance, which is in our Western world. And in the Eastern world, especially, being from India myself, the insurance models are very different. So the user actually upfront does pay for many of this. So you have to make the cost very adaptable, such that they can really get into the idea of using this technology. So that's how the vision with which this has been positioned in terms of cost of goods. And again, for more details, people interested, do reach out to Enlicense. I'm sure they'll tell you what their plans are.
All right, terrific. Thank you very much for this fascinating introduction to your technology. The archived version of this session will soon be posted at www.acs.org/ACS Spring 2021 conferences. This has been our final news briefing from ACS Spring 2021. We hope that you have enjoyed these briefings, and thank you for your attendance and participation.